Weird. I was quite sure I started. Okay. Well, hey. Okay. Okay, so now we're in Vensim through that introductory dialogue. So, ladies and gentlemen, suppose that we want to build up a model where we have people divided into susceptible, infected, and recovered categories, and people got infected over time, and they recover over time. How would I do that? What do I add? Okay, start with a stock. Okay, so which are the stocks, sir? The what? Okay, the box. But which variables are stocks? We need stocks for which things? Susceptible, infected, recovered. Okay, so let's do that. Susceptible, and then so I just clicked on this. So Vensim is modal, so you click on that, and then you can click here to use it, right? Susceptible, I'll call it infective, just to be quite clear. This is someone who's not only infected, but also spreading infection. And I'll click over here for recovered, okay? Okay. So there's some stocks, right? So what are the flows associated with this model? Sorry? Okay, good. So we'll have a birth flow here. Okay. So births, excellent. Births, okay. Good. Okay, susceptible to infective, what should we call that? Infections or something, or infection, sure. And then infective to recover, maybe we could call it recovery, right? Okay. Sorry? Okay, good. Good. So where would we add deaths? Good. From all of these down? Okay, should we do that? Okay. So I'd actually like to suggest, just by way of building it up incrementally, could I suggest we start with something super simple and we'll just add successive pieces? So, ladies and gentlemen, I'd like to introduce you again to our Pac-Man friend here. And let's kill off bursts for now, okay? So they're bursts. And then you notice when you kill that, this sort of residual remains, but you can kill that there, okay? Now, it's very important once you use this to delete things that you go back to a mode where you're no longer sitting in that mode, because otherwise it can eat up things you didn't intend it to later, okay? There's also an undo key, controls it. Vensim. It doesn't? Oh, what is it? Okay. Oh, okay. So they got rid of the Pac-Man. Okay. Yeah. Okay.
It makes you feel like your mouse is the Pac-Man. It's actually eating something instead of like, I'm just.
Yeah. Yeah. Okay. It's a more active sort of active component. Okay. So we have this model. If we wanted to get this model to the point where it could be run, what's needed? First of all, how do we know what needs to be filled in Vensim? Sorry? Okay, good. So when we go into equation mode, it goes black. Okay? So so this is telling us things are needed. Okay, ladies and gentlemen, what's needed for susceptible, infected, and recovered? Do I need to specify a formula for them? No, just initial values. Okay, for susceptible, I'd like to put in, I think I had 999 as the initial value for susceptible, okay? So, but, you know, something in me revolts against just putting that. That's just bad practice. So I'm going to put in a variable called, and I'll get to you just a sec, Farhad. I'm going to put in a variable called initial population. This is going to be a constant. So how do I do that in Vensim? Okay, yeah, I do this variable. It's called an auxiliary or constant. So I go into this mode and I put initial population, okay? And now we're going to have susceptible here be initial population minus 1. initial population minus, oh, you folks, I think it should allow this events of PLE, just fine, yeah. So that would be fine. So what did I just do? I set this variable, I went into these stock, and I set that to be the initial value here, right? And I'm going to set infective to be an initial value of 1. We're going to start with a single index person infected, okay? Single index individual. And ladies and gentlemen, recovered will be 0, okay? Okay, and just for completeness, to finish the thought, initial population, we're going to set to be 1,000, okay? Okay? Okay, now,
What was the initial population minus 1 part?
susceptible, the initial value of susceptible is initial population minus 1. In other words, everyone except the first, there's one infective, everyone else is susceptible. Recovered is 0. Who needs help? Oh, okay. Sorry? If one. One person. It's a good person. Okay. Okay? Oh,
I have a question. I don't know if this is
okay. Fahad raised his hand earlier, though. Yes. 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 Yes.
I think there is a time variable in the model.
That's right.
But I
Got
wasn't
it.
able to use it.
Okay.
So you just use an extra variable and
Sure.
yeah.
We'll make this happen. I'll show how this happens. Okay? How to use that how to use that variable. Yeah, you could create a variable that artificially is time by creating a stock that accumulates over time from 0. Exactly. But yeah, there's a much easier way to do it. In fact, maybe I'll just introduce this notion right now. There's a thing called a shadow variable. And a shadow variable basically allows you to denote a variable which exists elsewhere. It's not defining it. It's just providing a reference to it. So here, if you click on that, then there's a variable called time, and you could create a reference to it. And then you can end up using that, for example, here, if you wanted to. Yeah, so shadow variables and Vincent are your friend. Unfortunately, they're kind of a shy friend, and so they don't tell you about them. Kurt, you had a question?
I did, yeah. When I draw a causal arrow between the initial population and susceptible,
Yes.
it disappears.
Indeed. Indeed. This is one of the quirks of Enzym. The quirk is that, in general, when you have a formula for a given variable that depends on other variables, it not only generally supports, but it requires you to draw a line for dependency. The exception being initial values. Initial value doesn't require that. It's just a quirk.
You don't have to draw the arrow?
No, no. Did,
But
you did have to?
I did have to draw it,
Really?
and then it disappeared.
Oh, okay.
But I had to draw it first.
You had to. Okay. Okay.
Or else
That's,
this will have
Well, otherwise they would not.
sure. The formula for susceptible is this guy here, and I think what's going on probably is that when you draw it, it's going to, yeah, sure. By the way, it told me there was an arrow there. Well, okay, I would have expected it would allow me to choose it here. Is that what you did? No? Okay.
Oh, yeah, that's why I did it.
You could choose it. Exactly. But you could actually, what I did was to type it in. So I just typed it in, and it's, yeah, yeah. Okay, so ladies and gentlemen, let's complete this model. So if we wanted the infectives to recover in some average period of time, what would we do? Question? Yeah. Yes. That's right. That's right. So I think what Fahad is referring to is if we go here, there's this type here, and it gives a bunch of different types of variables. Briefly, an auxiliary variable is a variable that depends on others, like it's a formula of other variables. Maybe someone could help Sarah get started with the bits of the model. That would be great. A constant variable is just as constant like we had initial population. A data variable can draw data from files. Okay, it can draw data, in other words, from files of data which might have been produced by other Vensim runs, or they might have been imported from spreadsheets or other constant files. So if we had if we wanted to say have births coming in, and we wanted to have births coming in at certain rates for different years based on historic patterns, we could declare that as a data variable, and it would suck in its data from a given file. Okay, so we could do that. An initial value variable basically allows us to sort of sort of remember the initial value a variable had long after the initial time of the model has passed. So we might want to ask, for example, how much is this stock increased over its original value? It allows us to remember away its original value in a straightforward way. So we can create an initial value that sort of is the initial value of that stock. And its job in life is to remember that initial value. There's other ways to do it too, but it's a straightforward thing. You could actually do that with a constant, but there's going to be some initial. So there, it's not a terribly compelling case, but you could imagine there's an initial value of a flow that depends on this stock and that stock and a bunch of other calculations, and you could remember that away. Okay, or the initial prevalence in the population, which is a function of a bunch of things. So it's not, you don't know ahead of time what the value is going to be. Yeah. A level variable, we know what that is. A lookup variable will allow you to, you can think of it as a function from x to y. So it allows you to say 4 times 3, the value is this. For time 4, the value is that. Or, for this age, the death rate is such and such. For this other age, the death rate is such and such. Something along those lines. And a reality check variable is used to sort of, as part of the process, to compare a model's results to some historic data that you want to sort of compare it to and get a sense of whether it's reproducing certain patterns, something roughly along those lines. Okay. Okay, so that's a good question, and there's lots of other features that we'll see here. In general, for a substantive model, putting things in the comments field is good, and we'll later in the class we'll see units here. Okay, that will be after we do the basic agent-based modeling. Okay, so this is good. So Sarah's getting started here. I had said do susceptible, so I'll. Okay. Oh man, I said this was a reality check. Okay. So I want this to be a level variable. Thank you very much. There we go. Okay. So suppose we wanted people to remain infected for a certain average period of time. How do we do that? Suppose we wanted people to remain infected for a certain average period of time. How do we do that? Good. So be a duration of infectiveness or something like that, or duration infective might be a better way to put it. And if I want to change its name, by the way, I can, in this mode where I can create variables, I can also go and change them. So duration infective might be a sort of shorter way to say it. Okay. So if this is the mean duration infective, how would I make it so that that's operationalized? In other words, so how would I change the model so it is the mean time infective in the model? What do I do? If I want to make it so in the model, so right now there's a variable called duration infective. but I could change it to be, any value I want. I could have called it, your monkey's uncle, and it would, or your uncle's monkey, and it's not gonna actually do anything right now. Right now, it's just sitting there in space and sort of isolated away. If I want this to be the mean time people remain infective, what do I need to do to make that happen? Okay, align to recovery. And what else do I need to be going to recovery? Okay, what is this called? What do we call this sort of bundling of infective and recovery? That is a first order delay. It's a first order delay. So give me the formula for recovery. Sorry, I like to emphasize basics. It's a reality check. So what's the formula for this? Infective divided by duration infective. Are the units of that correct? Is this dimensionally correct? So what flows are measured in what? Per time. And here we have a value per time. So we're happy campers. Okay, so so that's good. And Vincent can actually check that. We won't go into it now. We'll explore it later in the course. Yes. You could. We won't be doing that right now. I'll be talking about that later in the semester as I'll talk about how you can do it, some in any logic, but especially in Vincent, later in the semester. Yeah.
You can add this right now.
Oh, yeah. Yeah, sure. If
There is a reason that it's better to just stay at some point
it's good practice to add them in. It's just that not everyone here will be from a background where maybe the notion of units are clear. So I was going to present a sort of module, a class on what it means to assign units and then show how it can be done. But it's good practice. I mean, there's nothing that would stop you. I mean, if you wanted to put in units, Fahad, you could go, people per day or something like that, and then you'd assign the units of infective would be what? People, yeah, and you could go down and consistently. So duration infective, we're going to assign that to be 10. I think was the number that I'm going to be using here. Yes, 10. It's called mu here. Mu equals 10. So let's make that duration effective 10, and for Fahad you could do 10 days, right? Yeah. Okay. So that would be fine. Sure, I'll fill it in. I mean, you folks don't have to follow along, but sure, I'll do 10 days. And for recovery, I'll do people per day. Sure, that's great. By the way, it knows about the equivalence of days and day, so it knows those are the same. 1 day it can be quantified in days, etc. Okay, so there we have one piece of our model. What's the other piece that still has to be filled in? This can run. Sorry, infection. Okay, so ladies and gentlemen, you tell me what the core formula is for this. Remember that? We need a. Okay, so there's actually several components. So if we had to describe the number of people getting infected per unit time, how would I calculate that? Based on what here? Okay, number of susceptibles. So it's going to depend on susceptibles. So let's add a formula from susceptibles. Good. What else is it going to depend on? I'm going to drag this and make it nice and rounded. So what else is it going to depend on? Okay. Force of infection. So it's susceptibles times force of infection is really what it is. Force of infection, how can we unpack that?
We need to the risk of infection per content. The mean.
Okay.
Contact.
Okay. Mean contacts per day. Okay. So this is a per mean contacts per day. So here we'll go create a variable called contacts per day, right? good practice to give explicit names to these things. We could just put all the values in the formulas, but then if we want to change them, we wouldn't know where we had to go. Maybe the same value would be located several places, or one, that value minus 1 will be located in another place. It's good to give it a name, and we could refer to it from many places. So there'll be a context per day. Great. What's another thing? It depends. I heard a probability of transmission per discordant contact. What do I mean by discordant contact? I mean per contact between a susceptible and an infective. Okay? So maybe that goes without saying, but if there's a contact between an infective and infective, what's the chance of transmission? 0. There's no transmission. Between a susceptible and susceptible, 0. It's between a susceptible and an infective that there's a chance of contact, and we'll call that beta. It's a, we might call it transmissibility, would be transmissibility. We could call it transmission coefficient, might be another thing, or we could simply call it, we could call it chance per discordant contact of transmission. I'm going to call it transmissibility, okay? Transmissibility. Okay, so what else does it depend on? The force of infection. So remember, the number of people per unit time who are going to get infected is the force of infection times the number of susceptibles. Force of infection is given contacts per day. If they ain't having contact with anyone, there's no infection transmission. There's transmissibility. If there's no chance of transmission from one person to another, it's not going to get transmitted either. What's another thing it depends on? So consider me, I'm a susceptible. My chance of transmission depends on how many total contacts I have per day. It depends on if I run into an infective, there's a certain chance I'll get the infection from that infective. But what else does it depend on? Number of infectives around. How many of my contacts are with infectives? What fraction of my contacts are with infectives? So if I meet with 100 contacts per day, what fraction of those are infective, eh? So how could we tell? So the assumption here, and it's key, in these models, we're going to see this next lecture. We're going to see this change. We're going to see a different type of modeling where we can make a more fine-grained assumption. But here, the assumption is that that my chances as susceptible will depend on, for my group, here the entire population. We could make it a smaller subset of the population in other models. Here, what fraction of my group is infective? So, ladies and gentlemen, create for me a variable that gives the fraction of the population that's infective. Okay, good. Yeah. Good. Good. Excellent. So we're going to call this, with a nod to tradition, we're going to create a variable called infection prevalence. Okay. Sometimes we might want to say it's a fractional prevalence, just to be very clear. It's a fraction of the population. We'll just say infection prevalence. And we'll draw a link from infective to infection prevalence. Eh? So it depends on infective. What else does it depend on, Fahad? Oh, okay, the infection prevalence, though, it depends on what? Okay, a total population. Now, we could connect these up to that, but it'd be better practice to have a variable called total population. Okay, so let's create a variable. Why? Because we might want to use it in many other places. Maybe we want to ask what fraction of the population is susceptible. What fraction of the population is recovered? Maybe we want to use it to graph out the total population over time to make sure it's not going extinct due to some variable change that we might have imposed on our model in the last minute. Kurt didn't get that, but okay, so we're going to create a variable called total population here, and it's called total population. Okay, actually, yeah.
What do you mean by infection prevalence?
I mean the fraction of the population that's infected. Okay. That's a word, prevalence, that means something, and it basically means how common the infection is. Okay.
So it means what fraction of the population is currently infected?
Correct. Currently infected. Okay, we're going to create a population called, a variable called total population, and that's going to depend on what? Susceptible, infective, and recovered. It's important as we add new stocks in to this model that we'll add them to the total population as well. That's an important thing to keep in mind, that sometimes these formulas have to be updated, okay? So we're going to make total population depend on these things, so let's go in and make total population depend on. Now I like to do it in the same order, just for conceptual clarity. Susceptible, infective, and recovered. Just because it's very easy to glance at it and make sure they're all present. If you have them in different orders, it's sometimes more cognitive overhead. Okay, so what is infection prevalence? It's telling us we still have to fill this in. What's the formula for it? Good. Okay, infection prevalence, the fraction of the total population is effective. Give me the formula. Divided by total population. Now sometimes when we do divide by, we have to be careful. It could be a divide by 0. In this case, it would only be 0 if the total population is 0, which is unlikely to occur. There is a function in Vensim called ZIDZ, which basically allows you to do a division where, consider a case where we have infective divided by population. Imagine a case where total population is 0. What does that tell us about infective? It's also 0. So sometimes if we're taking like the fraction of something, we know if the denominator is 0, the numerator has to be, and we want to treat it as 0. Then we can use this thing called 0 if divided by 0, and it takes two arguments, infectives and total population. If the latter one is 0, it just uses 0, otherwise it divides the two. Okay, so that can guard you against divide by 0 cases. Okay, so now we have this infection prevalence. So, yes, Fahad.
Is it possible to use something like an structure?
Yes, it is. Yeah, you could do that just as, you could do it as well. It would just be a little bit more wordy, right? You could do it, and it's a great question. Vensim does support if-then-else structures. You could see there's this construct called if-then-else, and it's basically like a ternary operator. For those for whom this is a meaningful thing, in C-oriented languages, there's a thing called a ternary operator. You see similar things in SAS and SPSS actually for things. So it says like, if a condition is true, under that situation, we'll do one thing. Otherwise, if the condition is false, we'll do something else. Like that would be an example of a ternary operator. What is this? So if we had in Vensim if, then, else, if, then, else, and we had x greater than 0, we had x, otherwise minus x. What is this doing conceptually? It's taking the what of x? Taking the absolute value. If x is positive, it just uses x. Otherwise, if it's 0 or negative, it takes minus x. 0 is 0. If it's a minus value, it takes its minus. So if it were minus 1, if x were minus 1, this would return what? 1. If x were 1, this would return, this x were 0, it would return. Yeah, so we can do that, Fahad, using if then else, okay? And you could have, for example, if then else time is greater than 10, do this, otherwise do that, as long as you know about a shadow variable. Yeah, okay. So, ladies and gentlemen, let us complete our model. Tempus fugit, okay? So let's compute this model here. So what do we need to fill in still? Sorry? Contacts per day? Okay, so what I'd like you to fill in for contacts per day is, oh, I said per month, okay, oh, fine. 10 contacts per day, okay? And you have 10 contacts with anyone per day. And then for transmissibility, I'd like you to use 0.04, okay? 4% chance per contact between a susceptible and infective that it'll be transmitted. Think of this as the number of people you stand close enough to catch an infection from them. So catch flu from. Okay? Okay, so we've just filled those in. What's the final thing we have to fill in? Infection. Okay, so what is infection going to depend on? On what is infection going to depend? Okay, susceptible, and, well, okay, does it depend directly on infective? Infection prevalence, right? And that depends on infective. So there's no need to hitch it up to infective directly. It depends on infectives, yeah, through infection prevalence. And what else does it depend on? On what else does it depend? Contacts per day and transmissibility. Now, if we had really wanted to be nice, it was noted earlier, we actually could have created a thing called force of infection. A variable called force of infection, which would depend on transmissibility, contacts per day, infection prevalence, and then infection will be force of infection times susceptible. That would have been an alternative way to do it. Well, for simplicity here, I'll just do it this way. But that would have been, in my view, even nicer. Okay, ladies and gentlemen,
So what do you want to mean by force of infection?
it's a chance per unit time you'll get infected. Chance per day in this case.
So what is the difference between transmissibility and force of infection?
Transmissibility is, well, who could tell me what's the difference between transmissibility here and force of infection? Can anyone else say?
Force of infection includes all of your transmissibility is just if you come in contact with somebody, what's the chance
Right.
of getting it?
Right.
It doesn't include how many people you're contacting a day and how many of those people are infected.
Exactly. So if there's nobody infected, there's still a transmissibility. There's a theoretical, okay, if I were to somehow come into contact with someone who's infected, there's a chance I'll get it. That's what transmissibility is. A single person I'm in contact with, what's my chance of getting it? Force of infection is, given the characteristics of the people around me and the number of people I have contact with per day, and the transmissibility, what's my chance on a per day basis of getting infected? That's quite different, because there I may be having contact with thousands of people per day, okay? And so I may have a chance per day of getting infected. It's very, very high, even though the transmissibility, the chance per infected person I contact may be very low. I've contact with enough people that my chance per day is quite high. Is that clear? Yeah. So it's something that's different. Another way to think about it is transmissibility has to do with the chance per special contact, per this discordant contact, this contact between a susceptible and infective. What's the chance of transmission? The force of infection has to do with just, given the situation I'm in, as a susceptible, what's my chance of getting infected per day? It's not per contact, it's per day. Does that make sense? Okay. Okay, so ladies and gentlemen, let's save this model. So I'm going to save this and I'll provide it to you. Sorry? Force of I didn't. Do people want to add that? It would have a sort of nice beauty to a sublime beauty. Would you like me to do it?
Yes.
Sure. Well, I thought it's a little bit sublime. It's subtle. It wouldn't be captured by anyone who came in contact with this. Okay, so let's add one. We'll see how we can refactor this.
I just looked up the word sublime.
Uh-huh.
Of such excellence, grandeur, or beauty as to inspire great admiration or awe.
Okay, well, it's in the eye of the beholder. Maybe for some of us, it enjoys sublime qualities. So here we're going to add a variable called force of infection. Here, force of infection. Okay, folks, on what is force of infection going to depend? You tell me. By the way, it is kind of nice we can separate this out, because then we can see how force of infection changes over time. So on what does force of infection depend?
All the things except for susceptible.
All the things except for susceptible, because this is the chance each susceptible will get infected. So Depends on transmissibility, it depends on contacts per day, and it depends on what? Infection prevalence. Does it depend on anything else? No. Okay, not in this case. Okay, so I just hitched those things up to it, and let's make force of infection then depend on these things. So ladies and gentlemen, how does it depend on these things? Multiply by them. Okay, contacts per day. I have contact with 100 people per day of whatever sort. What fraction of those people are infected? Infection prevalence. So I have contact with 100 people per day. 50% of them are infective. In other words, infection prevalence is 0.5. So I have a contact with 50 people total per day. And each of those people I have contact with, each of those infectives I have contact with, have a certain chance of transmitting me the infection, transmissivity. Does that make sense? Okay. Okay, so ladies and gentlemen, let us now complete the loop. From force of infection to infection here, we have an arrow. And now we can go and edit infection. And what does infection now depend on in this refactored system? Susceptibles and force of infection. Now, personally, I'd like to put force of infection first because I like to phrase this like alpha times x, where x is the stock. But it can be done in either order because, after all, times commutes. Multiplication commutes. Okay, so I have force of infection type susceptible. And if we say enter, it'll say, oh, it's not used. Oh, this is Vensim PLE's nonsense. So, okay, so we have to leave out of that. Now we have to use our Pac-Man or our trash can, and we have to delete the appropriate arrows because it doesn't depend anymore on transmissibility. It doesn't depend anymore on contacts per day, and it doesn't depend anymore on infection prevalence. This is what it depends on. The sublimity, the sublime character, but seems to be lost on Kurt. I'm sorry? Is indirect, right. They're indirect. Very good point. It's not direct dependence. It's indirect. Okay, so infection now depends on force of infection times susceptible, and there it is. I'm going to save this. So this will be 213, 10, 10, first SIR model, okay? Okay, so ladies and gentlemen, who needs help? Who needs help? Okay, no one needs help yet? Okay, so let's run this thing. So let's run a baseline. We go up here to the top and we say baseline. We run it. So this is the name of the scenario that we want to run. We could type it in, we can press enter, and it ran. And ladies and gentlemen, what should I see if I go look at infectives? Okay, up and then down. Okay, so there's an outbreak, and it dies off. And we discussed last time the reasons for that. At this peak, what's the characteristic of that peak? At that peak, from a level of the whole population, what's the character? Why does this, at the peak where it's flat, why is it flat? Why is it not changing anymore at the peak? Okay, so from a global level, the fact that that's not going up or down there means the number of infections per day is equal to the number of recovereds per day. From the level of a particular person, that person's infecting exactly one person to replace them before they recover. On average. Well spoken. Mean field model. Okay, so here we have a situation where we have some baseline. And we could obviously go and change things. So ladies and gentlemen, I'd like to go into synthesis mode. Up here, I'd like to create an alternative scenario. Maybe we say, well, instead of alternative, which is kind of generic, maybe I'll say low transmissibility. Okay, so we're going to lower the transmissibility. We're going to ask people to exercise extra levels of hygiene, which will allow it to be less likely to be transmitted. So I went up, I typed this in, and then we can do this synthesis. Now, Kurt, what is this, the icon for synthesis? Is it also a running man in your version? What is it?
Less interesting.
Okay, sliders.
Yeah.
Okay. So ladies and it's like this sort of thing, Kurt? Like,
Oh no, that's right. It's just a play button on top of a field.
okay. Okay. So ladies and gentlemen, here on into this mode, and we're now in this synthesis mode, and it's actually sometimes it gets in this situation where it's drawing. It takes a while to draw things, as Kurt knows. So in this mode, we can adjust things. So I'm gonna click here on transmissibility and lower that to 0.02, to half its normal value. Okay. And I press enter, and it's actually computed. It's sort of redrawing things. Why is it taking so long to redraw? Well, we took 1,000 times each. Sorry, 1,000 time units each. So 1,000 days each day. We've told it to integrate very small. You'll notice I mouse over this, and the infection prevalence, not surprisingly, is lower, and it's also it's delayed. The infection spreads less quickly. Ladies and gentlemen, I'd like to do one more situation with even lower transmissibility. I'd like to change this transmissibility to be 0.005. Okay. So, ladies and gentlemen, that's 1/4 of what we're currently using. It was 0.02. It was originally 0.04. I've now changed it to 0.5%, 0.005. Okay? And, oh, I should have, well, okay, it's too late. So I'll say okay. Sorry? Well, okay, now it's late. Yeah, I could have cancel, I know. So ladies and gentlemen, what do I see now? What sits in front of me now? Where is it? It's what?
You broke Benson.
Okay. So how about susceptibles? What's going on? Folks? There's no infection going on. In short, we have succeeded in realizing the dream of the public health system. We prevented the outbreak from occurring. Hygiene was so good that the infection didn't spread any significant amount, and the number of susceptibles wasn't depleted. There was no real outbreak to speak of. Ladies and gentlemen, I'm going to quit out of this. Now it's going to remember those runs that I ran, okay? And in fact, if we went out here, you have a similar control panel. You can actually go and you can see the different runs that have occurred, okay? You'll notice there's 2 of them loaded. There was another one I ran previously called current, but I don't have it loaded here. And I can go look in this mode. I can go look. I'm out of the synthesis mode, but it remembers the runs. I can go look at the number of infective individuals. And, I'll see this, but it's not terribly,
It's only giving the baseline.
it's only given the baseline. Did I knock it out? That's a curious thing, why it's not displaying, here, I don't know what I did. I say graph of infective, and you notice it's too small there. So if we wanted to investigate exactly where this low transmissibility scenario went, how could we do it? First of all, we could go and we can look at the table mode, and it says, yeah, I can't print out all things. You'll notice one is for the baseline, that's the red, and you notice that's rising. It goes from 1 on the far left to, so let me go back. So at time 0, it goes from 1, and it goes upwards in a sort of hideous succession. You'll notice the number of people getting infected is rising. See that? The number of people infected? But what's going on with this low transmissibility scenario? Over time, you could just take a look at it. Is it going up or down? Down. Okay. So ladies and gentlemen, you don't have to follow me in this, but I'm going to knock out this low transmissibility scenario so I don't have to have it clog up my graph. And I could watch this. Ooh, there's the base. I'm sorry. I meant to do the opposite, excuse me. I only want to pay attention to low transmissibility, not to the baseline scenario, okay? And I want to go look at infectives here. Double click on that. By the way, when you click on a thing here, it sets that as the sort of what's called a workbench variable. So that's the one that will be displayed when you do use graphs here. So I click on that, it's going down. Why is it going down? Because
Never successfully infected.
yeah, I mean, on average, they're infecting fewer than one person per unit time. Their basic reproductive number, the number of people they infect over the course of their illness is what? Well, they're in contact. Imagine if they were susceptible or surrounded by purely susceptibles, which is basically the case at the beginning. Each of those persons would come into contact with how many contacts per day? 10. Each of those contacts would have a chance of transmissibility of what? Well, this alternative value, which we could, it's 0.5%, right? So the average number of susceptibles that infective would come into contact with per day is what? The average number of susceptibles they come into contact with per day is, well, 10 total people. That's true. And and for those 10 people, you would have you transmit on average to how many people per day? 5. Well, yeah, half of a percent of a person. Which
Half a person.
Half a person,
10 people.
yes, half a person, this is per person.
no, yeah, this is no. So folks, 10 people per day you're coming into contact with. 10 total people per day. Your chance of transmitting an infection on a per person for each of those persons is not 0.05, it's 0.005. So over those 10 people, how many people on average would be infected? 10 times this, right? 10 times this. 0.05. So 1/20th of a person. And that doesn't just mean their nose or something like that. It's less than one person per day. How many days are they infective?
Yeah, because it's saying, so you have 20, you have to have 20 days
That's right.
to
To replace yourself
replace yourself.
on average. So let me see if I can again rehearse that. Consider a given infective. They're surrounded by susceptibles, entirely surrounded by susceptibles. They have 10 susceptibles with which they come into contact with per day. I'll phrase it another way, which might be easier to reason on. 10 total susceptibles per day. 10 days of infection. How many total susceptibles over the course of their infection? 100. 10 per day times 10 days. 100 people over the course of their infection. For each of those susceptibles with whom they're coming into contact with, they have a chance, for this scenario we ran, this alternative scenario, they have a chance of 0.005. So on average, they infect how many people? Half a person. So on average, they don't replace themselves before they recover. Chances are even that they won't have anyone to replace them by the chance that they recover, right? So that's why the infection is dropping. It's dropping because they're not even replacing themselves. The number of people is going down. Does that make sense to people? Okay, so that's the so-called basic reproductive number. The basic reproductive constant. How many people they would infect if they're surrounded totally by susceptibles. In this case, the infection doesn't even outbreak. Now, ladies and gentlemen, last time we saw that when an infection does outbreak, at some point it turns around. In fact, we saw that earlier, right? That infection rose and fell. And a similar phenomenon is going on there because there's a basic reproductive number, number of people I would infect as an infective before I recover over the total course of my illness. There's that chance in the context of being surrounded by all susceptible people, right? But in general, what happens is as an outbreak goes on, there's more and more people who are no longer susceptible, right? And so so for the base case, well, let's rehearse this. For the base case, we have the same contacts per day, the same contacts per day, same duration infective. So how many people over the course of the illness for the baseline? 100, 10 per day, 10 days infected, 100 contacts, right? And transmissibility was what for that? 0.04. So how many people in the baseline would someone infect at that first infective, that index case? They're going to infect how many people before they recover? Roughly? 4. 4 people. Okay, that's great. So that's why it starts taking, well, I mean, from the perspective of understanding it, it's great. So that's why it starts taking off here. So here we have, let me make sure it's in the right order here. So consistent order. So that's why we see this outbreak. But ladies and gentlemen, as those people in the population get infected, as we infect more and more people around us, eventually the number of people around us who are susceptible is going to reach a point where the number of people that infective replaces over the course of the entire illness is just 1. And that's where it peaks, right? And that's based on their effective reproductive number, not just their basic reproductive number. How many people they infect at the very beginning, surrounded by all susceptibles. We saw what that is. It's 4 in this case. But now we have to consider also the effective reproductive number. How many people they replace before they recover at any point in this outbreak. Ladies and gentlemen, here in the baseline, which is what's shown in red, they replaced that infected how many people before recovering? We just said it. 4. Here, they replaced how many people before recovering? 1. So their effective reproductive number went down from 4 at the beginning. It so happens they're surrounded by all susceptibles, to a situation where they're surrounded by lots of non-susceptibles where their effective reproductive number is 1. And that's that key tipping point. Thank you, Fahad. That key point where it sort of turns around and it accelerates downwards, because here there's fewer infectives, there's fewer susceptibles after that tipping point, and so it accelerates downwards in this sort of characteristic way. Okay, so ladies and gentlemen, that was our sort of basic